Welcome to The Point of View. We're on City TV and we bring you the latest current affairs issues across the world. My name is Bernard Avle. Here on this program, we get the right guests. We ask them relevant questions on issues that matter to you. And we are in the throes of a global pandemic that's causing fear across the world. And continue with our series of shows on it. We have two very important guests we'll be talking to on the latest with attempts to prepare Ghana for what many people predict will be a very serious spike in cases. We'll be talking to you with your WhatsApp comments. If you are watching on television, please send us your views on the number on the screen. If you're watching on social media, also comment on the stream underneath. When we come back, I'll tell you more about who we have for tonight. Welcome back to The Point of View. So even before we introduce our guests, Ghana's case count has increased. Now we have 27 and the death toll is 2. 2 people have died. We'll read that story for you. But this was confirmed moments before we came on air. Ghana's case count has jumped from 24 to 27. And the story says the Ghana Health Service confirmed the new cases on its website. A total of 521 suspected patients, according to the GHS, were tested for COVID-19 by Noguchi and KCCR. Out of the suspected cases, 27, including 2 deaths, have been confirmed. All the 25 cases are receiving treatment in isolation. The statement added but failed to give details on the patients who passed on, although we know a 61-year-old Lebanese based in Kumasi was the first person to die. Now, the Ghana Health Service stated that among the confirmed cases, 20 of the people are Ghanaian nationals, majority of whom returned home from affected countries. 7 are of other nationalities, namely Norway, Lebanon, China, France, and UK. In respect of contact tracing, 598, almost 600 have been identified and are being tracked. One of the contacts developed a symptom and has been confirmed positive. 19 people have completed a 14-day mandatory quarantine. This means that there are now local infections or transmissions as well. So that's the first point to note. The second piece of information, again, is that the United Kingdom has issued a stay-at-home order. So that's also news we just got before we got in. British Prime Minister Boris Johnson has announced essentially a lockdown of the country. And the new restrictions were announced. And of course, essentially means that there will be movement, which would mean that you can only shop for basic goods and there's a ban on gatherings. Police will be given powers to enforce restrictions, including fines. And the UK has 35 people who have died. The global case count is about 350,000 and 15,000 deaths have been recorded. So the United Kingdom has issued what is called a stay-at-home. Some will call it a lockdown. Now let me bring you to Ghana. The Bureau of Public Safety this morning also recommended that Accra and Kumasi should be in lockdown. I'm going to read that story for you because that's actually the base of our discussion for the first part of the show, whether a lockdown is necessary. If it is, what we must do to make sure it's effective. What are the steps we must take and what are the various things government has to consider if it were to do a lockdown. But let me read the Bureau for Public Safety story for you this morning. The Bureau of Public Safety has called for immediate discriminated lockdowns, they call it, of Greater Accra and Ashanti regions for at least 21 days. They called for the lockdown of all ministries, departments, agencies, and all MMDAs. It added that essential services could be exempted from this lockdown. In the heirs to government, the Bureau called on the President to draw some lessons from countries such as China, Italy, etc., which have been hardest hit by the pandemic, and timely actions of Rwanda, which have seen fewer cases, yet has taken a bold decision to do a lockdown. Again, before we came on air, we saw that South Africa had also announced a lockdown. This was announced by President Jacob Zuma moments before we came on air. So what am I going to do tonight? I'm going to be interviewing in studio live an international law and governance expert who has a blueprint if we were to go for a lockdown, what it would mean and how we should do it. Because our case is different from other countries. He's in the person of Mr. Kwame Mfodwo. He's my guest in studio. Welcome to the show. Good evening.
Thank you very much, Bernard.
It's good to have you. We would also cross over to Beijing. And indeed, over the weekend, I spoke to Ghana's ambassador to China, His Excellency Edward Boateng, And we discussed China's own lockdown. In fact, in Wuhan, people have been in their rooms since 23rd January. Believe it or not, 23rd January. We'll draw some lessons from China. And for the 5th straight day, there's been no local transmission in China. So China's case count is actually not moving as fast. So China presents an interesting experiment on what to do. They also did some fumigations, which we've done earlier today. So I'll go to Mr. Boateng and speak to him later during the show. Let me start with Mr. Kwame Mfodwo, though. So what's the... Welcome to the show one more time.
Yes, thank you again.
We just heard of Jacob Zuma, South Africa, 21 day. UK has arranged or has announced some severe lockdown as well. Based on our case count and the way the numbers are going, is it inevitable that we would get to a point where we would have to say nobody moves? Is it inevitable?
I think it is inevitable. The key issue is that we actually have to have a lockdown which is defined to and matches our context. Mm-hmm. Now, my view, and I've done a fair bit of reading on this for, I would say, probably the last 6 weeks. Mm-hmm. Basically, my view is that we have lessons to learn from China, but we also have lessons to learn from lockdowns and quarantines which have actually occurred in our region. I'm talking about Liberia, Sierra Leone, Guinea. They basically have had Ebola-related lockdowns. There are differences between Ebola and COVID-19, but the social context is the same, and in many cases, these countries are much worse off than we are in terms of infrastructure, slums, city conditions, and so on. So there's some lessons to be learned from there. But I would say, yes, we're definitely going to have to go to a lockdown. Now, it's really important that we define what the objectives of a lockdown are. My sense of it is that the objective will be for the nation to master the management of the disease, including appropriate medical management therapies. And then another objective would be, the most important one, control the spread, and if possible, basically just terminate community-acquired infections, because that's a more difficult thing to actually control. Mm-hmm. Now, we also need to be able to be sure that we can achieve tolerable levels of hospital care in the areas where the major hotspots are. And in fact, the Bureau of Safety report itself gives us some idea of, the focus that is required from the government. Really tolerable levels of the healthcare system in place in defined areas. So at least, those would be the primary points that I would make at this stage.
Before we continue, I want to show viewers the global state of play for COVID-19. And for this, I have the John Hopkins dashboard. And it's pretty scary because I'll put that on the screen shortly. The red dots will show you the case counts, and the size of the circle will tell you the severity of the case. Now, Italy is closing in on China at a very ferocious rate. So, as we speak, there are 372,563 cases globally. China has 81,496. Now, Italy, which a few weeks ago was less than half of China, is now 63,927. So, Italy is trailing China by less than 20,000. The US is now in the third position, 41,708. Spain, 33,000. Germany, 29,000. Iran, 23,000. South Korea, 8,000. That's even below France of 20,000. Now, South Korea initially was number 2. Iran was number 3. Now, Italy, US, Spain, Germany have all had more cases than these countries. In the top 10 is also Switzerland and the United Kingdom, which just announced its own lockdown. Now, in terms of deaths, Italy is now 6,077, almost double that of China. China is 3,153. Italy is now 6,077. Spain is 2,207, and Iran 1,812. Really, really troubling indeed. Now, if you also looked at active cases as against total cases, again, China is in the lead, closely followed by Italy, and then USA and Spain. So these are some of the numbers. And you're seeing This is some document, essentially the way the virus has moved in countries. So initially you have China, Japan, Singapore, Hong Kong. China is increasing, and this is time. So this is 14 February, 15 February. Now notice how the United Kingdom, the United States will start moving up on the screen I'm showing you. Now we're putting all this together to tell you that a lot of countries, now Italy, look at this. Italy has 7 cases. And then Italy just jumps all the way to 102. This was within the 1 week from 18th February to 24th. Italy had fewer cases a month ago than Ghana, right? A month ago in Italy, if you watch the flow, Italy had about 7 or 8 cases. By 25th February, Italy had jumped. As the graph is showing you there, first week of March, Italy is number 3. All right? Now, second week of March, Italy, number 2, 9,000. Okay? And then this ends on the 15th. But as I speak to you, Italy has 63,000 cases. It's possible they could even outpace China. Very, very serious indeed. So let's come back in. So you're saying that if we want to do a lockdown, it must be idiosyncratic. It must be based on what we have here. There's no world blueprint for lockdowns.
No, absolutely not.
But what can we learn from what happened in Sierra Leone and Liberia during the Ebola?
Okay, let's actually just fast forward to that.
Yes.
In terms of the brief that I provided to you, it's actually at the end. But let me just very quickly scroll and find it, and I'll just make some very quick points from there. Now, the thing is that the most important thing from our point of view is this, that Ebola as a disease has particular characteristics. They are different from COVID-19. It's not possible in the time available to us to go into that in great detail, but that is something that needs to be borne in mind. However, the really interesting thing about both Liberia and Sierra Leone is that the governments there did a mix of quarantine types. There was, in the case of Sierra Leone, a whole national lockdown for 3 days. Then in the case of Liberia, particular counties were isolated, partly the specifics of Ebola, but particular counties were isolated and then those were quarantined. Now, the most important issue is that one of the areas that was quarantined, there was a significant riot and social protests. There's quite a lot of guns in Liberia. People shot back at the police.
People were not happy with the way it was done initially.
Precisely, yeah.
Okay.
So there were a mix of quarantines was used, and it's only Sierra Leone which actually went into a national thing, but they were only able to manage it for a short time. And that has implications for us. Those implications are basically that as we sit here now, we can go into lockdown now in our current state of play, but we can't maintain it for more than 3 days or a week because people don't have food, people are going to starve and so on.
So you're saying as we sit here, we haven't planned for a long-term lockdown. If there will be a lockdown, it has to be initially a short one to allow us to understand the situation before we have a longer one?
Let me just say that I don't know what the government is up to. And I'm quite sure that the government is looking at this and has been looking at it. So I'm not making any criticisms, whatever, of the government. I'm offering a set of suggestions and ideas. But one of the main things is that we cannot go for, we need a long-term, not a long-term. Let's be frank. We need something like 1 month, 6 weeks, maybe even 3 months, right, of a lockdown. But we can't actually do that immediately. But we can do a short-term thing which we then roll and progress and improve on. And I think that's
so you're saying that
for
a long-term lockdown to be effective, certain things must be put in place.
Absolutely.
Otherwise, the people would push back and you're going to worsen the situation.
It won't be sustainable. Yeah, precisely. That's the point that I'm making. And the work that I've done, basically, I've tried to look at it in terms of a phased or sequence thing. Things that you actually need to do now and which are okay because it will take us for a week, 10 days max, and things that you actually have to roll up, which will then allow us to go further.
So let's talk about what we need to do now.
Okay. All right. So right now, I would say that those areas which have been identified as particularly problematic, if it is possible to do, as the Bureau of Public Safety.
Accra and Kumasi.
Yeah, precisely.
Accra, Tema, and Kumasi.
Yeah, whatever. They've done some work. So we basically look at that first. And then really within that, it's really important. Let me just say something about the the public health messaging, you see, because part of the problem that we are having at the moment is that we have really quite good public health messaging on the prevention side of things, but we don't have any public messaging at all on the lockdown, which will happen, right? So really, right now, we have to start looking at what kind of public messaging is appropriate to lockdown. For example, people live in compound houses. What does lockdown mean with respect to compound houses, shared facilities, and so on? That's one just very quick example. I've got some questions here. I mean, for example, we know how to prevent COVID things with hand washing
of
and so on.
hands
Yeah.
and things.
But if somebody gets sick inside your house, what do you actually do? Do you take the person to hospital? I mean, what do you do? All the stuff that we've got so far is Western oriented. All those videos and so on and so forth. They don't match the situation of compound houses and shared bathrooms and so on.
So something like social distancing is not true to the way we live in, say, Agboboloshi.
Absolutely. But it doesn't mean that the situation is at all hopeless, you see, because it's scenario stuff and simulation stuff. The typical compound house, we now have to look at it. What are the measures that are appropriate to a typical compound house? We then design and put out the public information which matches that particular situation. So it's not all bad. And part of the experience from Liberia, Sierra Leone is this is exactly what they did. After a certain period of time, they realized that they have to match it to the circumstances. They did the work. They had particular treatment center things. And if you allow me, I actually want to really make a point about this, the approach to medical management and to treatment. And I'll be really blunt. I'm a member of a group which has been advocating chloroquine. We are urging the government as a matter of national security, national interest, to move on this chloroquine front. Please, 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 Mr. President, do this because it's going to save thousands of lives, okay? But I promise you I wasn't going to talk
No, fine. So you're saying that of all the things we're thinking about, we should also start thinking about a clinical solution.
Absolutely.
Because for now we are doing prevention, border issues.
Yeah, precisely.
So you really we
and I'm not saying that the thinking is not going on. Please, once again, the thinking is going on. But all I'm saying is that the urgency is there, but we need to convey it even more strongly. And the chloroquine issue is something we have to look at because there's been massive progress on that. But today we're not talking too much about chloroquine. Hopefully, you'll allow us to come back and talk about chloroquine at some point. So let me get back to the lockdown stuff in a little bit more detail. So what are the problems and issues that face us if we are to go to a lockdown? Now, as a matter of culture, as a matter of politics, as a matter of psychology, as a matter of economics, people have mastered a particular way of life to survive. We're now asking them to change it. So psychologically, we really have to work out ways.
You have to prepare people
precisely
for this,
but also move them along, during the period. Now, the principal problem facing us is that people survive on a day-to-day basis. So if you are going to lock them down, people are going to starve. Let's be honest about this. Unless you have a proper set of backup measures, which the government has to think about. There's some very easy things. Is it basic packages of food which need to be organized, sorted out, given to people? We have all sorts of systems of distribution. Here, the churches come in. The churches know everybody in their particular groupings and so on. So we need to use the churches. How do we replenish stocks? How do we ensure stability of prices? Because there's a key thing in a long-term lockdown. The first phase, you have to let people out. We learned this from China. They have to be able to go and buy stuff. In the meantime, are the people selling the goods going to have jacked up the price 3 or 4 times? Price controls, stability, and so on.
We're showing videos of Italy and how the streets have emptied. They're showing you Spain as well. There's a few people moving, but it's essentially almost an empty street. So this is what a lockdown looks like in terms of what's happening. Of course, in the more advanced countries, people go to the grocery shops and buy food. So they go to the big markets, Asda, Tesco, and all these. But in our situation, people shop in corner shops, they shop in markets. So, and we don't have as many so-called groceries in the way we buy things. So that's the point you're making. That
but you see, this is now context because the streets are generally empty. right? They will be empty and are locked down anyway. We have markets. So we really need now to look at our main market types and how are we going to structure people coming in to actually shop during the period that you let them out, because you have to let them out. Nobody in Ghana is going to be able to stock up food for 6 weeks.
Even 2 weeks is
because then you've got the electricity problem, you've got the water problem. How are you going to freeze food?
But a quick one. In China, I'm told that people had to stay home and things were brought to their doorstep. Could that be the way we do it?
Well,
where
so
you
that
stay home
requires
and
a
then
level of organization. Yes,
you move rather into their homes and say, here's rice, here's stew,
precisely, which means that you're actually going to have to get your system of, the basic package sorted out, your system of rationing, a system of collecting information from people by mobile phone, how many people do you have here, etc., etc. And then you have to check, of course, that people are not cheating and taking up more than they should actually take.
Okay.
Then the question of, let's move to the question of income. Okay.
Yes.
Yeah, that's really important because the government has to work out a way of providing some kind of income support. That is all that really I can say. They have to think about it very seriously because we can't do 6 weeks or even 8 weeks without some form of income support. People survive on a day-to-day basis and so on. I've got some ideas here. We don't have the time to go through all of it, but of course it might be possible to put this up on your website, etc. So there can be follow-up on that.
Because if you look at the foods we eat, for example, a lot of them are perishable. So apart from rice, a lot, like if you even keep ripe plantain, beyond a week and a half, it's gone, right? So you're saying it has to be very carefully thought through. And if we haven't done the thinking through, announcing it initially would not work. And then there also needs to be some sort of fiscal government resource made available. Because a lot of people, we showed videos of people in the markets. After the fumigation of markets, some people have to sleep in the market tonight. And we don't even think it's safe, but they don't even have anywhere to sleep. So it's very serious. It's
okay, so can I just go to some of the measures? So assuming, I'm not suggesting that this is the duration, but if you had to do a 90-day emergency set of measures, 90 days is 3 months. You can cut it back to 2 months. Okay. So one, we need an emergency revision of the budget with tailored economic measures that are fit for this particular purpose.
Okay.
But that requires information. We need a quick survey of the hardest hit segments, travel, tourism, and so on. That's obvious. But there's all sorts of sectors which are hit now and which are actually going to be hit even harder as a lockdown goes on. We need speedy emergency clearing of raw materials from the port, pharmaceutical manufacturers, all those things. There has to be a major task force approach. You go out there, you clear the goods. They have to cut out all the red tape and so on. Then, really, we're talking about this as week 1, week 2. Support measures, special lending rates, rollover of loans and overdrafts, minimum daily wage payments to workers in particular segments of the economy which are hardest hit. People whose income would have dried up over 2 or 3 months need to be identified, etc., etc. So there's a whole lot of things, and that some of the 100 million can actually go to that.
So you need to have a fiscal plan.
Yes.
Great. Okay, I'll take a short break. When I come back, we'll try and wrap up your proposals because I want to go to China as well, and I'll read some comments. We're talking a potential lockdown and what it would mean and what has to be done for it to be effective. My guest in studio is Kwame Mfodwo. Later on, I'll be speaking to the Ghana ambassador to China, His Excellency Boateng. Stay with us. Welcome back. This is a point of view. Quick information. Ghana's case count is now 27 with 2 deaths. Earlier on, I referred to South Africa's president as Jacob Zuma. Actually, his name is Cyril Ramaphosa. So please correct that if you thought he had come back to office. Jacob Zuma has his own problems. Hello, Bernard. It's about time the government activates its business continuity and crisis management planning to fight COVID-19 from Ecotema Committee 25. Good evening, Bernard. All over the world, the cure for this pandemic is lockdown. What is the president waiting for? Benjamin Asabi from Takwa. I love City TV. Good evening, Bernard. WHO has repeatedly warned that international bans can block needed resources or delay aid and technical support. Such restrictions are justified at the beginning of the outbreak to buy nations time to prepare. The agency said beyond that, they are more likely to cause significant economic and social harm. Kwame Poma. Do you think the government is ready for lockdown? How are we going to feed the population? That's why I brought Kwame Mfodwo to prepare us for that. Hello, Bernard. I support the total lockdown of Accra and Kumasi to prevent the spread of pandemic, because how many ventilators do we have in this country? The situation can get out of control. Kwejo Ban Daniel from Adabraka. You have a minute or so to tell me the most important things we should think about before our lockdown. Mr. Mfodwo, what's the most important thing whoever is thinking through this should remember before imposing this lockdown?
This lockdown has to be done in phases. You have to make sure that you've defined the phases and you have the measures appropriate to each phase, because we cannot survive for more than a week, really. So, and this lockdown also has to have flanking and supporting measures of an economic character. You have to make sure that businesses, the pressure on businesses is lowered. You have to provide income support to people. It's not a question of procuring goods with 100 million. That 100 million has to be used to support the people of Ghana.
Great.
That's my message.
I'll put your article on citynewsroom.com and I'll send a copy to the powers that be, and hopefully they will see the wisdom in it. Now let me take you to China. So before the weekend, I spoke to Ambassador Boateng via Zoom. So those of you who are wondering whether I was coming to the studio, I should wear a face mask. It was just a communication we did via technology. And we really wanted to know how the Chinese had started turning a corner. Because at the time we did the interview, they had the second straight day of no local infections. Now it's 5 straight days. So essentially, we wanted to see what the situation was in China, how they dealt with their own lockdown, because it's been on in Wuhan since January 23rd, and then also the issues that came up. Why didn't they bring the Ghanaian students back? Is it true they send them only one ball of kinky and some small shito? We discussed all of that. I will show you that and I'll come back and read the rest of your messages. So here's my interview with Ambassador Boateng. Now joined by the Ghana Ambassador to the People's Republic of China, Excellency Edward Boateng, to give us an idea of the situation in China. 2 big stories we've been following today. For the second straight day, there's been no local infections. And for the first time, total deaths, number 1 figure is not from China. Italy has surpassed China. Ambassador Edward Boateng, thank you for joining us. How is China this morning?
Bernard, thank you very much. It's been a while. I hope you're doing well.
Yes, I am.
I think we woke up to good news today for the second day running. We didn't have any confirmed case or suspected case in China. And that is very, very good news. However, China is not out of the woods yet, as the authorities have told us. They're going for 14 days. If we go for 14 days without any suspected or confirmed case, then it means that China would have been very successful in its containment and treatment of the virus so far. However, we still have the challenge of imported cases. Yesterday we had 134 new cases, but all these were from people coming back into China from outside. Mm-hmm. So they have put in place very, very stringent measures for people who are coming back in to ensure that the virus is not imported into the country. So we are good. Wuhan recorded 0 case, and it's a very, very good story for China and for the world community.
Well, as we are recording this, Ghana's case count has jumped from 11 to 16. Can you remind us of what the Chinese did in the initial stages of the numbers coming through, and what can we do or learn from what they did, which can help us to manage this?
I think what China did, and which worked very well, was the fact that once they realized the severity of the pandemic, the messaging was very clear. They have a central command in terms of the messaging and in terms of the directives. Also, the strategies were very science-driven. It was very, in terms of data collection, in terms of tracking of people. I think they did a very, very good job. There was also very effective public education and sensitization, as well as mobilizing the general public. And one of the things that I really admired was that people, whether they were the Chinese or those of us who are living here, just took all the information and implemented it meticulously and diligently. And I think that also helped. There was also very good coordination from the government to the local authorities. And even in our case, for instance, at our mission, we had very good implementation to ensure that nobody got infected, because the way this virus is so contagious, the way I conduct myself is important to your well-being. So you could do all the right things, but if there is somebody within your group who doesn't conduct himself or herself, all your efforts are in vain. So I think the coordination is important. There was also the rapid response. I mean, where I live, for instance, if they heard of any case, immediately there would be a reaction from the authorities. And I think that was also important. But most importantly, I also think that high tech, the use of technology, has helped a lot. It helped in tracking, it helped in the treatment, and it helped also in the monitoring of people's behavior. I think that also helped. And also the discipline of the people themselves. I think all that has helped.
How was the lockdown? A couple of days ago, somebody sent me a message that in his province, he hadn't really left the province since 23rd January. And he was speaking to me sometime, I think 16th March. So this is a month and a half. If we said Wuhan is in lockdown, can you describe that? Is it that nobody can come out of their house, or that they can't come out of the city? How did it work?
Well, in Wuhan and Hubei province, the lockdown meant that you could not come out of your house. You were basically within your house, or if you lived in an apartment, you stayed in your apartment. And it was so strict that in some places you couldn't even go out and throw your own garbage away. Somebody would come, you'd leave it behind your door, and it would be picked up. So that's what it meant, that you were in your apartment or your house. In places like Beijing, it was also very strict, but we could go out and shop. I mean, you could go and do your grocery, because grocery shops were open. But in all these, whether you were in Hubei or whether you were in Beijing or whether you were in Guangzhou, it meant strict adherence to the protocols that had been put in place. One other area that I also didn't mention in the previous question was personal hygiene, ensuring that we abided by the protocols. You know, as you were speaking, I saw you touch your nose. Those things, and I did it earlier. I mean, those things were all diligently implemented. So lockdown means that not going anywhere and staying within your compound. We had community policing, like for instance, where I live. If they didn't see you, somebody would come and check on you. And if there was somebody who came in from outside, the person's temperature would be taken, why do you keep scratching your face? That's not So
they'll check on you.
They'll check on you. Yeah. There was also the community policing itself. So it wasn't only from the authorities. Like I said before, my behavior totally impacts the rest of the society in which I live. So there was that community policing. There was also community shopping. In some of the areas, you'd select one person who would do the groceries on behalf of everybody. So they would come collect your money and the things you wanted, and they would go out and do the groceries on behalf of everybody. So it's really being a community. It's really being helping each other. And one of the things that I believe that COVID-19 has brought also, it has brought out the goodness in the human being. People show you kindness, everybody trying to watch out for the other person. So that's
we saw videos of fumigations and sprayings and things like this. Was this carried out in Beijing too? And how did that work? Because it looked to us as if there were people wearing masks, spraying everywhere.
Yes, it was carried out throughout the whole of China, maybe more intensive in Hubei province where the virus was first detected, but everywhere in China, everywhere, even in our mission right now, we do fumigate, to make sure that the virus has not been left behind by somebody unintentionally. There's a lot we still have to learn about this virus. And I think the whole essence of the fumigation was to ensure that if there were traces of it, it would be killed or eradicated. So the fumigation was taking place everywhere. I think in places like Ghana, it's going to be very difficult for us to do that kind of fumigation because one, we may not even have the equipment, but what we can do is really the self-discipline. I think that's key. That's what is really key, making sure that we abide by the protocols that have been announced by the president, that have been announced by the health authorities. We should just make sure that we abide by those protocols. And also don't forget that at the beginning, a lot of fumigation had to be done because there was no clarity on the mode of transmission, whether it was airborne or not airborne. But right now, there is more scientific clarification. It's through droplets. It's through droplets, and you have to literally come into contact with it. It's not airborne. So I don't think we would need that kind of fumigation in places like Ghana.
Okay. Now, let's talk about the effects of this on business. A lot of our importers are worried that a lot of the goods that they sell here will not be available in the coming weeks. And basically saying that China is one of the main places where they import from. Based on where you sit, have you seen a drop in the numbers of things coming into Ghana? And how big a hit has this virus had on trade flows between the two countries?
Since January 23rd, China has been in lockdown. China arguably is the world's manufacturing hub. Nobody was working. So manufacturing of products has gone down considerably. Therefore, it is going to affect the supply of goods and services around the world. The other disturbing thing is that as China is coming out of it, we're seeing the unfortunate rise of the case in Europe and the US. So the entire supply chain of the world has been disrupted. It's a major, major disruption, which is going to take a while because the way the supply chain works now, if a laptop is being produced in China, maybe one part of it is being produced in some other part of the world. So it's a massive disruption. Now, where we are trying to help so that we can mitigate these shortages in Ghana is to act as a conduit for some of our traders. And we are working with the Chamber of Commerce in some of the various provinces. So if people really want to order, they don't have to come to China. If you have your own supply chain in process already, if you contact the embassy, we will work with the local Chamber of Commerce to ensure that they can pay on your behalf once you send them the money and make sure that you get the quality of goods that you want. It has to be a process that is well managed because if you send us your requirements and you want the goods immediately, it's not possible because a lot of countries are doing that now. So we will try as much as possible to help, but we have to also understand that the manufacturing process of the world has come to a stop now. So obviously there will be some shortages, not only in Ghana, but around the world. But we have to also use what we have more frugally. I keep telling people that this is the time to save your money. This is the time to make sure that whatever you have, you manage it very well, because we don't know how this is going to last. China did predict that by the end of April, it would solve this problem. We're in the middle of March, and they've been able to do it a month ahead. That is, if the infection rate does not go up. However, we're looking at what is happening in the other parts of the world. And yesterday, the experts in the US were saying that they thought this would go up to July or August. That is serious, and it's going to affect us. So we just have to make sure that we manage what we have a bit better.
What about the Ghanaian situation, the Ghanaians in China? Initially, when this started, the main news was about students wanting to be repatriated, and then you started sending them certain items. How are they doing, and is there still a clamor to leave, or now that things have started looking upwards, the conversation is different?
Well, the conversation has been different for about the last 3 weeks.
Okay.
Obviously, when it started, the Chinese authorities did indicate to all countries that had citizens here that people should stay, because nobody knew. They told us that this was very contagious and people should stay. And I wish that countries had heeded the advice they gave them. Maybe we wouldn't be having this massive spread around the world. We took that decision, and I think President has to be really applauded for taking that bold decision at that time to leave the students here, because he felt at that time that that was the best thing to do, because the Chinese had told us about the containment measures they had put in place. So as the ambassador here, we worked with the Ghanaian community, and I must say we've worked very well together with the student leadership, with the Ghanaian community. We were like eagles overlooking our eaglets. We were with them, talking to them, managing the situation. Unfortunately for us, none of our people got infected, and we didn't lose anybody in the process. The students are quite happy now. Government sent money, sent resources, and we've been able to manage the situation, sending them food and everything.
Wow.
All those things were in the pipeline. It's unfortunate that during the noise making, nobody called the embassy to find out what was happening, what was being done at that time. And we knew that we were taking the right decision to keep the students here. And today, if a plane was brought, I don't think any student would board, because they've realized wisdom in the decision that was taken at that time.
So just to be clear, you are saying that of the 81,000 cases in China, not one Ghanaian was affected, as in infected. No Ghanaian has been infected.
No Ghanaian was infected. I mean, look, it's easy if you abide by the protocols. If you abide by the protocols, you will not get infected that easily.
Okay.
I'm not saying that it's 100%, but wash your hands. Make sure that you don't touch your face. As we speak here, I have my mask.
Okay.
I will not step out without my mask. You have to wear your mask. You have to stay within your own confines. Unfortunately, during the evacuation process, you can get contaminated. A lot of people, especially people arriving in Ghana, maybe they got infected at the airport, because at that time, we didn't understand the protocol. That's why we felt that the students and the Ghanaian community had to stay here. So for us, we managed the situation. I mean, we together with the Ghanaian community leadership, the NUCS leadership themselves, we're talking to the students. I was on the phone. We had conference calls like this all over China, Zoom, talking with the students and managing the processes. So, but I also must say that it was only a handful of students that were making those noises. Okay. We were talking to the students, so we knew very much that we're in control of the situation.
So I see. So the balls of Kinke you send them and those things they were showing us, was it one ball per student, one ball, or how?
Some students were just trying to be naughty. What happened was that we decided to send them money.
Okay.
But then the minister, and I really appreciate her for that, out of her own motherly instinct, called me and said, look, the students are saying they don't have food to eat. And every university, we were in touch with them. And we knew that they were giving them food.
Okay.
I mean, obviously, you would not be getting the sort of food that you were used to, but they were giving them food. You know what I'm saying? So the minister said, look, why don't we send them some food from Ghana? And I appreciate her for that. So we sent gari, kenke, sardines, shito, fufu, all kinds of stuff. To be honest, I was very impressed because I hadn't even realized that now we're able to package all these things so nicely. So when the things came, my officers decided, they had to work 3 days continuous over here, because unfortunately for us, this thing happened right at the tail end of the Christmas holidays. So most of our officers are even in Ghana. So there are only 4 of us here.
Wow.
We brought some of our local staff, and they spent 3 nights packaging these things nicely. Now, the things went in boxes of 5, 6, some communities got 10. So when they got the first box, they decided to put it out there that they were giving balls of kenke. Each person got kenke, ga kenke, and fanti kenke. Okay. Sardines, shito, some got fufu, some got banku, and we added this way chocolate drink.
Okay.
So they got a lot of stuff together. Plus, in addition, they got 500. Let me put it on record that Ghana Embassy in China took better care of their people than any other embassy, including the Western countries. And I mean, we get recommendations all the time from the other embassies that, wow, you guys did very well. And we were in touch with them. In addition, we set up a counseling service from Ghana, where we had counselors on 24 hours to talk to the students. Because obviously, a lot of them, for the first time, had to go through this challenge of being by themselves. And, we are by nature, we like going out, talking to people. So if you are alone, it's difficult.
Yeah.
So we had Dr. Ama Edwin and co. 24 hours we were talking to these students. There are a lot of things were put in place, but we didn't want to engage them in a media war. It wasn't necessary. Okay. As I told the students, I just want to solve the problem, and we have solved the problem.
Great. Final 2 points, and thank you so much for talking to us on City. Your colleague in Ghana, the Chinese ambassador in Ghana, Excellency Xing Ting-Wan, just sent out an article where he pointed out the things they did in China, basically writing to say to Ghana that we are with you in this, and that he's sharing China's experience with the Ghanaian community. I'm sure you've seen this letter because you would have seen it before it came through. I mean, what do you make of that? The fact that he's taken the trouble to write to Ghana to explain and encourage us and say he thinks that we can also come out on the basis of what they just went through.
Well, I think first, I also like to use your platform to thank Ambassador Wang for being with us. I mean, we've worked very closely since the 23rd of January. We have spoken almost every day or every other day, him and I. When the students were agitating, he was always with me and talking, and also talking to the university authorities to make sure that our people were taken care of. So I'd like to use your platform to thank him very much, and also thank my minister, Honorable Shelia Yokobutri. I think she really, really did very well. And the president and the vice president, they were with us, as well as the chief of staff. I think what Ambassador Wang Shitan is trying to do is to encourage us, because they have gone through it, and to share their experiences with us. And I mean, they have already sent us some equipment and stuff to help us. I know for sure that they've sent masks, and they're sending respiratory equipment and some things to help us. China and Ghana go back a long way, but for the COVID-19, we were thinking of having a big celebration this year a big event to celebrate 60 years of our diplomatic relations. Ghana was the second sub-Saharan African country. So wow. we have to establish diplomatic relations. We have a relationship going back a long way. The message he sent out yesterday is to encourage us and also to tell us that China is with us. And I know very well because we speak all the time. We spoke yesterday, and they are ready to help us to also. We don't have a lot of cases now, but with this ones, I understand today we have 16 cases.
Yes.
We need to manage it because really the multiple effect is very fast. If you look at what is happening in Italy now, what is happening in Iran, so we have to be able to stop it. Otherwise, it's going to have a big effect on us socially and also on the economy. And I think that's what he is trying to do. But I know that they've extended a very good hand to help us in case we need their help.
Finally, are you going to make any request for testing kits or anything like that? Because so far, it's been social distancing, it's been precautionary things. But now that we have 16 cases, with I think 1 or 2 of them being internally transmitted, some people think that we need to step up our ability to test people. But we are not sure if all of those numbers would have the right testing kits. Is this something you're discussing at all with the Chinese?
Well, the Chinese entrepreneur Jack Ma has made available some of the testing kits. We are also talking to the Chinese here, but we cannot test everybody in Ghana. The Chinese didn't do that. What is important is for us to be disciplined, wash your hands. It's a very simple process. I've seen videos that have been put out by the Ministry of Information on how to wash your hands. You have to wash it and wash it well. Stay home. If you don't have any business going out, stay home, And we have to make sure that all the protocols that are being put out by the Ministry of Health and the Ministry of Information, we abide by them. If we are disciplined, we can resolve it. That is what has helped South Korea. That is what is helping Japan. That is what has helped China. If you don't have a disciplined process, then it becomes a challenge.
So that was Ambassador Edward Boateng speaking to me on Friday. And interestingly, the time the interview was recorded, we had 16 cases. Now we have 27 cases. At the time, we had 1 death. Now we have 2 deaths. And we're getting some reports about who this person is, an elderly person, but the details will be given on the website. Let's read a few of your comments as we wrap up. Good evening, Bernard. A total lockdown would be disastrous for the country, especially in our economy where majority are employed in the informal sector. This is from Mr. Eduhini in Adenta. Looking at how issues are arising with regards to COVID-19, the only way to go now is a lockdown. The 2 major cities, Accra and Kumasi, should be locked down. However, in locking down, what happens in areas without lockdowns? I suggest we intensify testing places for people to check their status. KK from Wa. Good evening, Bernard. A lockdown will be disastrous even to the average income earner. How much more the poor? The number of poor people in this country is extremely high. Ghana is not ready for this. Bernard, the toughest but most effective measure for government to implement is a lockdown. All the hand washing with soap and sanitizers have very minimal effect. It will be expensive but effective. Thanks to Ghana Post address system and vibrant ambulance systems while at home, we can be attended to. NADMO takes charge of all warehouses with food and collaboration with businesses. This is from Abdul Rahman. So for those of you just tuning, let me show you the latest case count. There you have it. Really troubling indeed. It was 16 on Friday, rose to 19 on Saturday. When the president finished his address, it rose to 21. By Monday morning, it was 24. Now it's 27. The deaths are now 2. So we have 25 active cases. We also have over 80 or so people in quarantine. All those who came by air between Saturday night and Sunday midnight have been quarantined and are being tested. So stay at least 2 meters away from people and avoid large gatherings. Wash your hands regularly with soap and running water. And for washing your hands, please do it for at least 20 seconds. At least 20 seconds. That kills the viruses. Maybe next time I come on here, I'll explain the the reason why soap kills viruses. If you wash your hands without soap, the viruses will not die. You need to use soap, any type of soap. But at least keep the water running for 20 seconds. It kills viruses. The hotline is 112. In case you have symptoms and you are in self-isolation, just call the hotline 112. Don't touch your face. I touched my face a couple of times in the recording. I'm learning how not to do it. And if you have engaged in any kind of international travel, please isolate yourself for at least 14 days. I'm going to end with a comment I got from our correspondent in the northeast corridor, the eastern corridor. So, Bernard, it's serious here. I visited the Tatale border, and it's very serious. The protective equipment are not available. And the sad thing is that officials do not want to speak for fear of victimization. Even sanitizers are not available. The drill assemblies are also incapacitated because there are no funds or resources, but they are just quiet because they don't want to lose their jobs for speaking the truth. Boss, it's serious. I have seen a lot today. May God help us. That came from Aminu Alabira, my Eastern Corridor correspondent. Let's stay safe. The President has called a fast for Wednesday. Let's all join. It's important to pray. So let's prepare for the worst, but hope for the best. My name is Bernard Avle. Thank you for watching us on The Point of View tonight. We'll see you next time. Bye-bye.